Welcome back to another episode of Board Bitesize. Today we are joined by our Chief Executive Jim Austin and our Chair Julie Holder. We've just finished this month's board meeting and stepped outside to reflect on what has been discussed today in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities and focus on the future.
So, hello, Julie Holder here as Chair of DCHS with Jim Austin, our Chief Executive, and we're just reflecting on our February board day today, some of the key points that we've talked about and decisions made today. As always, we're going to go through our strategic themes. I'm going to be talking about healthy communities and being fit for the future, and Jim's going to start with our people matter.
So, hello everybody. A very full day today, actually started early and finishing late, but I covered within the people element a thank you to all the teams, all the staff that have been working across the winter period really, so the Christmas break for those that had it, and then into the difficult weather that we've had. And we're just acknowledging the really hard work that people have been undertaking in difficult circumstances and the great position actually that Derbyshire managed to get into before Christmas, and the very hard work that we're working alongside colleagues to deliver the care for patients that we need to have. We also spent quite a lot of time in various parts of the board. It was highlighted in my report, but we picked it up through different parts around sickness absence and the board's concern around the levels of sickness absence that we have. Took some reassurance around the interventions that as a trust we're taking, some of it starting upstream around well-being, making sure people are looking after their mental health and trying to connect people in with that, through to some of the work that is being overseen by our Quality People Committee just around the sickness absence policy, the management structure and helping people to get back to work safely and as fit as they can do, and acknowledging that there had been some progress in that space. Also very aware at the moment around people, just the pressure that people are feeling. A number of the non-execs and Julie had been to visit teams. I've been with Julie to visit, it was the 5 to 19 service down in Swadlincote quite recently, just listening to them. Julie had been on one of our wards as well, where some feedback just around the pressure that people are feeling there, and rightly pushing back and say, can you just wait while I'm attending to these patient needs? So we listened carefully to that as a board, and the board discussed what are we doing to try and mitigate that as best we can.
Yeah, thank you, Jim. I think the day really started well around that healthy communities theme as well. We had a fantastic presentation and discussion on the care transfer hub, a huge piece of work which is part of the wider community transformation programme. And we heard of individual stories and of the success, but also the next steps. One of the things, though, that I think we've talked about before and we acknowledged again today, that change takes time. And whilst things are transforming and changing, it doesn't mean that everything moves on around us and demand increases. And we talked about that a lot today, and we can't lose sight of the efficiencies that the community transformation and the care transfer hub will actually deliver. But more important, I think we really felt today that it's the impact it will have on individuals' lives, about being in the right place at the right time to ensure a better quality of life. Your report also, Jim, included the proposals to strengthen clinical leadership and provide better joined up care, safe, high quality care around neurodevelopmental and older persons mental health services. And we also had the opportunity to celebrate the fantastic progress that's been made around obesity management and the reshaping of a single seamless model of care. Our performance report really shows positive impact of the community transformation programme, and we've worked really hard as an organisation to eliminate over 52-week waits and improve our 18-week waits and delivery of our 4-hour waits in our UTCs as well. So just continuing the theme there, Jim, it's a big thank you to everybody.
And then the other theme, and it was one of the 3 questions that Julie asked us at the beginning of the meeting. One of the questions was around, are we working in partnership? And I'm going to focus on partnership for the next couple of minutes. What we were able to unpack, and Julie's just mentioned the Community Transformation Programme and the Care Transfer Hub, was some really good examples of where colleagues in DCHS are working alongside with, and the phrase team of teams came up quite a few times, with teams of people from different organisations, the voluntary sector, not just health, local authority as well. So we unpacked some of that. We did talk quite a bit about we're in the midst of getting ready to submit our plans for next year, the finance envelopes and those kinds of things. So we talked about the partnership approach we're taking with our commissioners, the Credit Care Board, and also with local authority commissioners as well. And I was able to report that we've actually got very constructive, sometimes challenging, but very constructive relationships that are building on that. And it does feel like we're well placed for the planning submissions for this year. A tough year it will be, and Julie might cover some of that in the final section. But certainly when we checked back through the meeting, we could probably find examples of partnership going on in every piece, not only from the executives who are in the room discussing the work they're undertaking, but we could pick out examples, and the care transfer hub is a good one, where we could see the individuals delivering that partnership working. And very much, we also talked about the neighbourhood ways of working as well. And although there'll be a challenge from the NHS to standardise and harmonise and move everything up a level, a real recognition that when we look at the communities that we serve, we want to specialise and be careful around those communities. We also did a bit of development today around the Armed Forces Network and the Armed Forces Covenant. And again, we were able to reflect back that for the 4,000 or so veterans that live in Derbyshire and Derby, we could also map that to our population need and some of the work we want to do around addressing inequalities. So all round, actually, there was a lot of partnership discussed.
Yeah, and we did actually reflect on that throughout the course of the day as to how much work is being done out there with partners, but in the system space. As far as focus on the future is concerned, key to that, inevitably at this time of the year, was the 27 planning papers that we received. Lots of work being done in this area by lots of people, and a big thanks to everybody that's allowed us to be able to be in the position to submit a plan in the timescales that are required. Financial sustainability remains the focus within the NHS, and this year, or the coming year, there will be an efficiency target of 5.3%. That's £13.5 million, of which 9.3 million will be on a recurring basis. We've got to be, it's hard to achieve this level of saving, and people have worked with us to help get to the position of breaking even and being able to plan for a financially sustainable organisation. But that's about doing things differently within DCHS itself, but also, as you've said, Jim, in terms of working with partnerships and other agencies. It was good to acknowledge that DCHS have been placed in segment 1 of the NHS oversight framework, which is a really strong position. That's based on Q2 performance, and we're going to have to absolutely retain that focus on performance. I can't say enough about how it is important to look at the way we work, to transform the way we work, but that needs to be done within the provider collaborative space, and that's not just NHS providers, but a wider set of partners, which, going back to the beginning of the day, the success of the Care Transfer Hub is absolutely demonstrating that. That's it from me, Jim.
Yeah, and look, thanks for listening. I just thought I'd mention one other thing that Julie brought out for us. We have a tendency to focus on the things that aren't working, and one of our new non-exec directors, Greg, talked about an asset-based approach, an appreciative inquiry approach to what are we doing well and how can we do even better. And I'm just reflecting, I've had some really lovely personal individual feedback around individuals and teams, and I'm feeding back directly. They're from GPs, they're from the acute trust, they're from trusts outside our area, about the really hard work that you are all delivering out there. So just, final thank you from me, and we look forward to the next bite-sized board in a couple of months' time. Thanks.
Bye.
Bye-bye.
That's all for today's episode. Board Bite Size will be back after the next public board meeting.